Diversity in the healthcare workforce, evidence review. Cultural diversity in healthcare professions. The high level of racial and ethnic minority representation in the health workforce is an indicator of organizational cultural competence and the major prerequisite for the prevention of disparities in healthcare provision. The development of a culturally diverse workforce is a challenging task for managers as it requires a conscious effort in diversity promotion and the selection of appropriate tools, transparent HR management, staff education, and training, etc., aimed to create the motivational basis for the achievement of the desired results and enforcement of cultural sensitivity among employees. Employment practices as well as organizational anti-discrimination education, policy initiatives, and enhancement of communication, are essential to the development of cultural diversity and sensitivity in healthcare. Representation of the minor ethnic groups in the U.S. health workforce is important as it significantly affects the character of interactions between care providers and patients and increases the quality of service. The usefulness of the diversity information. There is a direct relationship between the lack of diversity in the health workforce and staff members' inability to address health disparities. Thus, the diversity information may be used to enhance the effectiveness of education for care providers and contribute to workforce diversification through the increase in healthcare workers' competence. There are no ready-made instruments for managing an ethnically diverse workforce, but evidence-based information may provide managers with frameworks that they can use to develop their strategies for enforcing racial equality and cultural sensitivity among staff members. The materials can be used for the achievement of greater diversity at the organizational level, which is associated with the increase in the depth of the health research agenda, as well as the number of trained executives and policymakers ready to take up leadership positions in the healthcare system of the future. The research evidence may be used for the creation of the informational basis needed for the refinement of the corporate culture, development of staff education programs, adoption of new managerial practices, and integration of new cultural values into professional practice. The cultural diversity in U.S. society is increasingly growing. The located information addresses the potential diversity-related risks promptly and allows the development of evidence-based strategies that can be implemented to enhance the ethnic concordance between the health workforce and society. Appropriateness of the photographs and graphic material. The researchers draw the official statistical data related to the demographic and ethnic composition of the healthcare staff members, and the prediction of the cultural diversity growth in the U.S. population. The study by Melillo et al. Provides graphic materials about the ethnicity of nursing students and their retention rate from freshman to sophomore years during 2007 to 2011. The provided graphic information and statistical data are consistent with the article's content and support the scholar's hypotheses, conceptual frameworks, and suggestions. The website and academic articles use official data retrieved from credible sources including the National Council of State Boards of Nursing and the Forum of State Nursing Workforce Centers. Perspectives. The increase in cultural diversity in hospitals may lead to the retention of the currently underrepresented minority groups in medical staff and increase care providers' job satisfaction. It is suggested that organizational diversity may help to develop trust among minority or socioeconomically unprivileged patients and improve patient outcomes and satisfaction rates. The located sources are useful for organizational development inclusive of equality, diversity and difference, accountable management practices, and effective leadership. Internal management issues. Organizations need to increase commitment to diversity through policies and legislation that promote equality of opportunities and support the work culture based on the respect and recognition of difference. Organizations should promote diversity through their hiring practices, posting job offers on diversity-focused websites or collaborating with state organizations. Diversity Awards. The National Diversity Awards honors employers supporting workplace equality and inclusion covering multiple areas of diversity including age, gender, sexual orientation, and religious and cultural backgrounds. The sponsoring organizations are Adidas Group, Excellence in Diversity, Microsoft, Lush, etc. Conclusion. Programs promoting ethnic and socioeconomic diversity in healthcare professions focus on the idea that the diversified health workforce helps to improve public health indicators and the quality of medical service. The review of the diversity information and research evidence reveals that greater workforce diversity may lead to the improvement of the work environment in hospitals, retention of care providers from diverse cultural and ethnic backgrounds, and enhancement of patient outcomes through the provision of greater access to medical service for the unprivileged populations and better patient-doctor or patient-nurse communication.